Okay, I think we're live. So let me welcome everybody here today. It's January 19th. Got bill hearings. Senator Chair Kelly, I believe, may or may not be on here. She has a bunch of competing things, so I'm going to handle the bill hearings today. We've got 7 departmental bills, 1 from the Department of Human Services, and then the other 6 are all from the Maryland Insurance Administration. So for a total of 7, and we're going to quite candidly, I think the simplest thing, we're going to start with Senate Bill 175, which is the bill from the Department of Human Services, and then we'll take the 6 MIA bills after that. So to get us started on Senate Bill 175, we've got from the Department of Human Services both Denise Conway and Greg Sessick. I don't know if you both planning to testify or you had made a arrangement. Okay. 2 of you.
I'm good.
Senator Klausmeier, you need to mute yourself. You're on. Okay, there you go. Okay, so is Mr. Sessick or Ms. Conway here in the House?
Good afternoon. This is Ms. Conway, and I will testify formally, and Mr. Sessick is here to also offer verbal testimony should there be questions.
Great. And we're not, because we don't have that many witnesses and these are all bunch of department bills, we're not going to keep a tight time clock, but if anybody goes a little too long beyond 2-3 minutes or whatever, I'm going to pull the plug on them. Okay. So with that said, Ms. Conway, you're on mute right now. You're gonna have to unmute yourself and I'm gonna let you start.
2 o'clock. Thank you.
Okay, well, Senate Bill 175, so it's all yours.
Thank you so much. Good afternoon, Vice Chair Feldman and committee members. I am Denise Conway, Deputy Executive Director of the Social Services Administration at the Maryland Department of Human Services. Also joining me today is Greg Sessick. He is the Director of the Office of Adult Services. I thank you for the opportunity to testify on Senate Bill 175. Protect vulnerable adults from financial exploitation by extending to financial institutions the ability to share financial information with Adult Protective Services, giving Adult Protective Services the opportunity to intervene more quickly and hopefully limit further damage. In 1999, the Graham-Leach-Bliley Act became federal law and removed federal restrictions on financial institutions sharing certain confidential information with Adult Protective Services during an investigation of financial exploitation of vulnerable adults. And in 2012, the Maryland General Assembly granted the department's Adult Protective Services program the authority to investigate financial exploitation of vulnerable adults and expanded mandated reporters to include employees of financial institutions. Since 2012, Adult Protective Services has received more than 6,000 reports of financial exploitation each year and investigated more than 1,000 cases of financial exploitation annually. Under Senate Bill 175, banks and credit unions will have the ability to disclose certain financial information to Adult Protective Services in instances where financial institutions were not reporters of suspected financial exploitation without the risk of violating state financial privacy statutes. This bill permits Adult Protective Services to disclose the status or final disposition of an investigation of suspected financial exploitation to a financial institution that made the report and will increase the cooperation and trust between Adult Protective Services and financial institutions when battling suspected financial exploitation of vulnerable adults. This bill constitutes several years' worth of collaborative work between Maryland's Project SAFE, Adult Protective Services, the financial industry, and sister departments, including the Department of Aging and Department of Labor. The department had the opportunity to review the Maryland Bankers Association's technical amendment, and I can confirm the department is in support. I urge a favorable report from this committee, and I thank you for your time and consideration and welcome any questions you may have at this time.
Okay, thank you, Ms. Conway. Before we go to any other witnesses, we'll take questions for Ms. Conway, starting with Chair Kelly. You've got your hand up, Chair Kelly. And unmute yourself, Chair Kelly. You got to unmute yourself. Yeah. There you
Rather than a question, I want to say to colleagues that this is an issue that I've worked on for many years. It's highly important. And I also serve on a bank board, and they would like to be able to cooperate when vulnerable adults are involved. They need this regulatory change in order to be able to do so. And none of us want the seniors in our districts to be vulnerable with no ability to get help between the institution that has their financial records and our department just trying to regulate and to be sure that they are not taken advantage of and exploited. So thank you for being here.
Okay, and I see Senator Hayes also has his hand raised.
Good afternoon, Ms. Conway, and thank you, Mr. Chair. There is testimony that's been provided by the Maryland Bankers Association that's requested an amendment where the department will have to specify the time frame in which they're requesting this information. I know you probably won't have a chance to respond to that later, but I was curious if you've had a chance to review the testimony that's been provided by the Maryland Bankers Association, and what is your position?
Thank you for the question, Senator Hayes. And the department has reviewed the amendment, and we are in support of the amendment.
Okay, thank you so very much.
Certainly simplifies some matters. Any additional questions for Ms. Conway? And am I correct that Mr. Sessick was just here for support to help answer questions? He's not adding anything?
That is correct.
Okay, fantastic. So with that, we're going to now move to the other witnesses who signed up. Favorable, starting with Tammy Bresnan from AARP. Tammy, I see you. You've got 2 minutes or thereabouts.
I will only be 2 minutes. Mr. Chair and Madam Chair, we are very thrilled to support Senate Bill 175. We are an active member of the Project SAFE. We work with the departments, the Department of Aging, the Department of Human Services. We have teletown halls trying to bring this, trying to highlight fraud and where people can go. This became an issue for us over 6 years ago when we were training adult protective service workers on the Eastern Shore. We're thrilled that the department put this bill in. We're thrilled that you all are hearing it and that the Bankers Association is on board. We ask the committee for a favorable report. Thank you.
Okay, thank you for your testimony. Any questions for Ms. Bresnahan? Okay, seeing none, we're going to go to the next witness. We've got Jeff Myers from the Office of the Attorney General. Mr. Myers.
Good afternoon. I'm here to tell you that the Office of the Attorney General is actually in support of this bill. We actually had Assistant Attorney Generals from the Department of Aging, the Commissioner of Financial Regulation, and the Department of Human Services who worked on putting this together and drafting the language. It arose, as others have mentioned, it arose out of the work of Project SAFE, which is a coalition of quite a few government and private organizations interested in combating financial exploitation of vulnerable adults and our seniors. We thought we were going to help Adult Protective Services by adopting a national form that's been put out there to request financial records from fiduciary institutions, banks, credit unions, savings and loans. The National Association of Adult Protective Services had created this form when the Graham-Leach-Bliley law was passed back in the late 90s to eradicate the federal issues with sharing this financial information. So we were just going to copy that form and Marylandize it. But when we got into the nitty-gritty of it, we found there were some obscure passages in the financial institutions article and in the human services article and the family law article that created impediments that made some of the APS people nervous about sharing information with the banks and made the banks nervous about sharing some of their customer information with Adult Protective Services. So what this bill does is simply take care of those little language nits and grits that made the APS people nervous and the financial institutions people nervous. And so we have broad support here. All these entities were involved in helping to draft the bill, including representatives from the Office of the Commissioner of Financial Regulation, the Maryland Bankers Association, the Maryland DC Credit Association, Department of Human Services, the Maryland Association for Bank Security, and as I mentioned before, the Office of the Attorney General. So we'd ask for a favorable report on this bill. Thank you.
Okay, thank you, Mr. Myers, for your testimony. Any questions? Senator Kramer, the senator from Leisure World.
Yeah, thank you for that, Mr. Chair. Ms. Conway, did I hear you say correctly that since this bill was passed and went into law, that you on average every year are doing 1,000 investigations into possible financial exploitation of our elderly residents?
Thank you for the question, Senator Kramer, and that is correct. Since 2012, we've received more than 6,000 reports each year and have investigated more than 1,000 annually.
And generally speaking, are our friends at the in the Maryland banking world being cooperative and helping and working with you all to ensure that our seniors are protected as best as possible from exploitation?
I'm going to allow Director Sessick to respond to that as he is more involved in the day-to-day work with our local departments.
Okay, Director Sessick,
Thank you.
Referred to, so you can take a crack at that question.
Thank you. Yes, we do have good relationships with banks in our work in investigating for financial exploitation. However, this has been a persistent barrier that this bill aims to remedy.
Good to hear. Sounds like it's a great piece of legislation and is working as envisioned. Thank you, Mr. Chair.
Okay, any questions for Mr. Myers from the AG's office or Mr. Sessick or Ms. Conway before we move on? Okay, seeing none. Speaking of the Maryland bankers, we've got the final witnesses signed up favorable with amendment is Ramon Lubi from the Maryland Bankers Association, along with Bob Etten. I don't know, Ramon or Bob, were you both going to testify or you both signed up favorable with amendment? Or which one of you want to lead off?
Well, Mr. Chair, Mr. Vice Chairman, I'll take it. If there are any technical questions or if Bob has anything else to add after my testimony, you'll hear from him as well. But good afternoon, Vice Chairman Feldman, members of the Finance Committee. My name is Ramon Lubi. I'm the president and CEO of the Maryland Bankers Association. Since our founding in 1896, the MBA has been the leading advocate, trusted partner, and exceptional resource for Maryland banks and the banking industry. Today I'm before you, and it's my pleasure to offer MBA support for Senate Bill 175. Elder financial abuse is a serious issue and one which our members have been engaged to help and try to prevent. The MBA is an active participant in Project SAFE, and we greatly appreciate the opportunity to work with the department on this legislation. While we support the bill, we have discussed an amendment, I think, which has been discussed here today with the department, which helps our members serve their long-term customers by specifying a time frame for the information requested. In short and in closing, the MBA commends the department for introducing this bill, an important step to further provide enhanced protection for Maryland seniors. We ask that the bill be reported out of committee favorably.
Okay, Ramon, did you submit actually in writing what this amendment is or what it looks like? I don't know that I see anything here, but
you should have written testimony from Drew Jablon with the Maryland Bankers Association, which has the written testimony and has the amendment attached to it.
Excellent, perfect. Okay, Mr. Egan, do you want to add anything?
The only thing I would add is we're really glad to see this bill become enacted. We're very much committed to addressing this issue. All of the proponents, the Department of Aging, Human Services were great to work with. And with this amendment, we think this will help protect our senior citizens. We urge you to pass the bill.
Any questions for either of our two witnesses from the Maryland bankers? Okay, seeing none, that concludes the bill hearing on Senate Bill 175. And now we're going to move to the first of 6 MIA bills from the department, starting with Senate Bill 167. And we're going to lead off with Commissioner Kathleen Bryan. Commissioner Bryan, I do know you're here.
Yes.
Okay. Now you brought a whole team with you also who have signed up. Are they here just for backup to help with questions, or are they going to themselves weigh in with any testimony?
They are here primarily to answer questions, with the exception of one bill where Associate Commissioner Cooney will provide the bulk of the MIA's testimony.
Okay. Which just is it a which of the bills is that?
At 185, which is the No Surprises Act bill.
Gotcha. Okay. So we're on 167 now. So let's start with Senate Bill 167. Commissioner Bryan, you're going to lead off.
Yes, thank you very much for the opportunity to testify. Senate Bill 167 is a departmental bill that clarifies that when an insurer's failure to fulfill a contractual obligation is also a violation of the insurance article, the commissioner's existing statutory remedy of restitution includes requiring the carrier to fulfill that contractual obligation. It's important to note that Senate Bill 167 does not change what is a violation of the insurance article, or when a failure to fulfill a contractual obligation is also a statutory violation. The bill also does not change the standards that must be met in order to find a statutory violation. So, for example, Senate Bill Section 27303 of the insurance article currently provides that it is an unfair claim settlement practice for a P&C insurer to fail to pay a claim, but only if the failure is arbitrary or capricious. This bill doesn't change that. If the bill passes, the failure by a P&C carrier to pay the claim is still not a statutory violation unless the failure is arbitrary and capricious. What the bill does do is make it clear that if the MIA has concluded that a particular failure to pay a particular claim was arbitrary and capricious, and thus a statutory violation, the commissioner's existing authority to order restitution includes the authority to order the company to pay the claim that was arbitrarily and capriciously denied. The MIA did introduce legislation with the same intent last session. It was, however, there were concerns by the P&C industry about that bill. We met with them, we heard their concerns, we revised the bill language. That revised language is reflected in Senate Bill 167, which is before you now. We are aware that there are some members of the P&C industry that still have concerns, and we have invited those representatives to meet with us and to talk about what those concerns are, to give us examples of what they think the bill will allow us to do tomorrow that we can't do today. And I look forward to hearing those responses and talking to them. In the meantime, in an effort to allay concerns, Mr. Dorsey from the Office of the Attorney General, who is the MIA's principal counsel, has advised us that the bill does not alter the circumstances in which the MIA can find a violation, and he is here today to answer any questions that the committee might have specifically in that regard. So with that, I thank you for your time and for your consideration of Senate Bill 167, and we ask for a favorable report.
Thank you, Commissioner Bryan. Any questions for the commissioner or for Mr. Dorsey, who was referenced a little earlier? Okay, seeing none, we're going to now go. There are several witnesses who have signed up unfavorable. We're going to start with Matt Overture from NAMIC. Matt?
Yes, sir.
Okay, it's all yours. You've got around 2 minutes if you can fit it in.
I will try to come in well under that.
Not going to keep a tight time clock too much today, but
Very good. Well, good afternoon, Mr. Vice Chair, Madam Chair, members of the committee. My name is Matt Overture. I'm speaking on behalf of the National Association of Mutual Insurance Companies. NAMIC is the largest trade association with more than 1,400 members, 22 of which domiciled in the state of Maryland. I'm in the unfortunate position today to respectfully oppose Senate Bill 167. We understand the problem that the department is attempting to address, but as drafted, we are concerned about the scope of authority that would be provided under the bill. Under existing law, the MIA has the authority to fine and require restitution for licensees. In addition to these formal statutory powers, the MIA has and uses less formal means to inform and encourage licensees to pay claims and meet the contractual obligations. NAMIC and its members companies work closely with the MIA, and we believe existing law provides sufficient oversight in the absence of alternative evidence. We are concerned that Senate Bill 167 would expand these powers and permit the MIA to require an insurer to pay claims where coverage may still be disputed, and we believe this determination is best left for the courts. We have shared our concerns with the MIA, as the commissioner mentioned, and we are committed to working with them to try to find middle ground on this issue. And with that, I will conclude my testimony. Thank you.
Okay, thank you for your testimony. Any questions for Mr. Overture? Okay, seeing none, the next witness signed up on favor was Bryan Popham. Mr. Popham? Unmute yourself. There you go.
Good afternoon, Mr. Chairman, Chair Kelly, members of the committee. My name is Bryan Popham. I'm appearing today on behalf of two clients, the Maryland Association of Mutual Insurance Companies, which is the state affiliate of NAMIC, from whom you just heard, and also the Insurance Agents and Brokers Association. My position on behalf of these clients in opposition to the bill has not changed, but my testimony has changed, and it's changed because of two things. One is the testimony that the commissioner delivered today, and also equally important from my perspective, a conversation that she had with the industry on another bill that led into this bill yesterday. I have a better understanding of what the commissioner is seeking to do, and I intend to discuss my understanding with my clients. And I believe, and certainly will work diligently to try to come to an accommodation so that the commissioner can achieve her reasonable goal of enforcing the insurance article, which is her charge legally in the area of claims. Having said that, I must add that at first blush, the language in Senate Bill 167 did raise some legitimate concerns, not only with my client and Mr. Overture's client, but others in the industry as well. And I welcome the commissioner's invitation for further discussion. And I will, Commissioner, convey to them your request for specific examples that you asked for, where this bill will convey authority you do not have today, and respectfully, we don't believe should be there. But I do want to emphasize, Mr. Chairman, that this is a situation where it's always difficult to oppose departmental legislation, but because we have a better understanding of what they're trying to accomplish under Senate Bill 167 from the commissioner's remarks, I feel pretty confident that we're going to be able to come to a mutually acceptable resolution. So with that, I'm not going to finish with my usual, we respectfully request an unfavorable report. We remain officially opposed to the bill, but I sincerely hope that our objections can be addressed in a conversation with the commissioner.
Okay, thank you for your testimony, Mr. Popham. Chair Kelly, you've got your hand raised.
Yeah, I was just wondering if between the opponents, who we respect greatly, and the commissioner, if you think a work group with a couple of members of the committee participating, so we understand more what the nature of the opposition is and what kind of accommodations you're trying to reach, or if you think you can get this done in a timely way without our butting in and interfering.
Madam Chair, there is a tradition of work groups in your committee and it's a very effective device, I think, to resolve issues. But I would defer to the commissioner to see how she feels about that. She's made an invitation. I, for one, will accept her invitation, and we certainly will participate in a work group if that is your preference.
We don't want to do one if it's superfluous, and I'm just wondering, Madam Commissioner, and those who are trying to protect the brokers from whatever it is, because we haven't really heard what your concern was, but we obviously know you have one, or maybe more than one. And so do you need a work group? Would that be helpful or not?
Chair Kelly, I very much appreciate your offer. What I would ask to do is, if we could have, say, a maximum of 1 week to see if we can resolve it, because I am hopeful that we can, but if we can't, I would respectfully like to come back to you and take you up on your offer.
Thanks a lot. If that's so, that sounds like we got a plan.
Thank you so much.
Okay.
Yeah, that sounds like a good plan. Before we move to the next witness, any additional questions for Mr. Popham? Okay, seeing none, we're going to go to Nancy Egan. Miss Egan, you're next up. Nancy, you got to unmute yourself, Nancy. You're muted.
Thank you. Good afternoon, everyone on the Senate Finance Committee. It's great to see you all again this year. I represent the American Property Casualty Insurance Association, which represents 1,200 insurers and reinsurers throughout the United States. And we write combination of 60% of the US property casualty market. I will not belabor you all with the same remarks that you've heard from our other people in the P&C industry. We began working on this bill last year with the commissioner and her staff. Our concerns were that the issue that was brought to our attention had been a issue with the health insurers dealing with mental health parity payments based on a market conduct exam. And our concerns was that there was an overreach to the P&C market because we felt that the commissioner still had the tools to enforce. Based on our conversation yesterday with the commissioner, we understand better her perspective of what she's trying to address for P&C issues. And yes, we continue our opposition, but we hope we can resolve that, and we would participate in both the discussions informally and any necessary discussions going forward. And we appreciate the commissioner giving us a better understanding yesterday on our call with her on some other MIA bills. Thank you very much.
Okay, thank you, Miss Egan. Any questions for Miss Egan? Okay, seeing none, the final witness signed up unfavorable for this particular bill is Bob Enton. Bob?
Thank you very much, Mr. Chairman, members of the committee. Robert Enton on behalf of the American Property Casualty Insurers Association. Just to echo what the other witnesses have said and what my client, Ms. Egan, has said, is we really appreciate the ability to have a dialogue with the commissioner in the hopes that we can get this worked out. So that's what we're looking forward to, and we hope we'll be able to come back with a consensus on the bill. Thank you.
Okay, any questions for Mr. Enton? Okay, seeing none, that concludes the bill hearing on Senate Bill 167. The next bill is Senate Bill 170. Back to you, Commissioner Bryan, to lead off.
Thank you very much. Again, I appreciate the opportunity to testify. Senate Bill 170 is a departmental bill that addresses the requirements of the annual review of title insurance producer operations that title insurance companies are required to perform. The bill does 4 things. First, it removes the outdated requirement that this annual review be conducted on site. The information that an insurer is required to review to maintain in order to conduct the review is maintained on systems that can be accessed remotely or through individuals who can be interviewed remotely. During the pandemic, the MIA allowed insurers to conduct remote virtual annual reviews. We required carriers to submit their review plans in advance for approval, and then we carefully monitored results. We concluded that all of the review requirements could and were met using virtual means. The movement to remote audits and reviews in the context of these types of audits is consistent with auditing best practices in other settings, and the MIA itself performs most of its exam functions remotely via access to the systems of its licensees. The second thing the bill does is it removes the also outdated requirement that the review include a review of the producer's policy blank inventory and processing operations. Producers no longer maintain inventories of pre-printed blank paper policy forms. Approved policy forms are accessed and completed online. The new language would replace this outdated language with a requirement to review the process for issuing policies. The third thing the bill does is remove the requirement that a title insurer send the commissioner notice of an agent termination specifically by certified mail, and instead allows the notice to be sent to the administration in the manner identified in a bulletin issued by the department. Finally, the bill authorizes the commissioner to adopt a form for use by insurers when submitting their review reports to the administration. So I thank you. I'm here to answer any questions, and we would urge a favorable report.
Okay, thank you, Madam Commissioner, for your testimony. Any questions for Commissioner Bryan? Okay, I do not see any. The only other non-MIA witness signed up is Mr. William O'Connell from the Maryland Land Title Association. Mr. O'Connell, there you go. Bill, okay.
Good afternoon. Thank you.
You signed up favorable with an amendment.
Yes, and I've submitted the proposed amendment. The commissioner did an excellent job of laying this out. Sometimes, you know, unexpected gives us gifts, and this was one where it showed us that we could do this remotely and not have to spend the travel expenses to go into everybody's office and be disruptive. So I commend the commissioner for bringing this bill. The only two suggested amendments are really to further clean up this statute. There's the use of the word examination occurs 4 times in section 3 and 4 of K 121. And I think, you know, back when the statute was created, they got confused or something, but the title insurers are conducting a review, and I think the first 3 times the word is used, they're referring to that review. There's nowhere else in the statute does it talk about an examination by the title insurers. On the other hand, the commissioner does conduct examinations, and so the 4th use of the term is appropriate. The only other amendment is to tie the reporting of these bad acts into the report that the form or the report that's going to be submitted to the commissioner. And with that, I will end my testimony.
Okay, do we have any questions for Mr. O'Connell? Okay, seeing none, that concludes the bill hearing on Senate Bill 170. We're going to next turn our attention to Senate Bill 180. Commissioner Bryan, Senate Bill 180.
Thank you. I will kick us off, but Associate Commissioner David Cooney will supply the MIA substantive testimony. Senate Bill 180 is a departmental bill that broadly authorizes the Maryland Insurance Administration to enforce those provisions of the Federal No Surprises Act that apply to insurers and health plans regulated by the Insurance Administration. Given that provisions of the federal law are already in effect, in our written testimony, we ask that the bill be adopted as an emergency bill so that it can take effect more quickly after what we hope to be its passage. And then with your permission, David Cooney will address the merits of the bill and explain the approach that we have taken in the bill.
Okay, Mr. Cooney, it's all yours.
Thank you, Vice Chair Feldman, Madam Chair, and members of the committee. The Consolidated Appropriations Act of 2021 was passed by Congress and signed into law by the President in December of 2020. The act included several provisions related to health insurance, most notably the No Surprises Act, and it is without question the most significant and far-reaching federal healthcare law to be enacted since the Affordable Care Act. Our written testimony provides additional details regarding the provisions of the act, but in general, The federal law is intended to completely eliminate surprise medical billing that occurs when patients unknowingly receive treatment from a non-network provider or do not have the option of choosing a network provider. The federal law identifies states as the primary enforcers of the new requirements, but the MIA currently lacks the authority to enforce these requirements under existing state law. So under Senate Bill 180, we are requesting the same type of authority that the legislature granted the MIA in the past for other federal laws such as HIPAA and the ACA. Granting the commissioner this authority will enable the MIA to directly assist Maryland consumers and will result in a clearer and more efficient regulatory structure for insurance carriers. Unfortunately, the federal government has been somewhat slow to release rules and guidance for implementing the No Surprises Act, and we are still waiting for clarification on certain items. So for this reason, we're currently seeking a law that grants the MIA broad authority to enforce the applicable provisions of the No Surprises Act, rather than attempting to revise individual state laws to conform to the new federal requirements. This is the same approach the legislature took with Senate Bill 57 back in 2010 when the ACA was first enacted, but Maryland and other states were still awaiting federal guidance. In future years, once we have more clarity at the federal level, further legislation can be proposed that will conform specific sections of the insurance article to the federal requirements, much in the same way we have done for the ACA. However, in the short term, it is critical for the MIA to be granted clear authority to enforce the new federal requirements. And for that reason, we urge the committee to give Senate Bill 180 a favorable report.
Okay, thank you, Mr. Cooney. Chair Kelly.
Yeah, it's a blessing to hear that we're moving at all in this direction on this. There are a lot of people here in the General Assembly who have worried for decades about the fact that somebody might be in an accident, be picked up by an ambulance while they are unconscious and carried to a hospital, maybe from the Eastern Shore to the Western Shore, and then find that they owe a $30,000 bill. So the base that you're bringing before us for action now is very important. And I hope that whatever attendant portions of the entire set of concerns need to be handled in the future can be worked on during the interim so we can move the rest of it. But we've had loads of citizens with $25,000 and $30,000 bills when they had no say, they were unconscious. Okay, thank you.
Any additional questions for either Mr. Cooney or Commissioner Bryan? Okay, seeing none, that concludes the bill hearing on Senate Bill 180. Next, we're going to go to Senate Bill 185. Commissioner Bryan.
Thank you very much. Senate Bill 185 is also a departmental bill. It will authorize the Insurance Administration to conduct hearings virtually. Under Section 10 to 11 of the state government article, administrative hearings that are subject to the Administrative Procedures Act may be conducted by telephone, video conferencing, or other electronic means, subject to the right of a party to object for good cause. The MIA is one of the few state agencies whose hearing requirements differ from the APA. The MIA's hearing statute currently requires that hearings be conducted in person. The Senate bill would remove that restriction, subject to the caveat that a person who cannot exercise their hearing rights by appearing virtually must be allowed to appear in person. At the outset of the pandemic, all in-person hearings had to be canceled and postponed, bringing consumer claim cases to a halt and creating a large backlog. The Office of the Attorney General advised the MIA that, unlike other agencies, it could not require hearings to be conducted virtually, but it could permit virtual hearings to occur if all of the parties consented. Virtual hearings by consent allowed a significant percentage of consumer complaint cases to go forward. However, the inability to require virtual hearings delayed enforcement proceedings. When the MIA issues an order against a licensee, that order is stayed when a hearing is requested within 10 days. A licensee who has requested a hearing could avoid compliance with an enforcement order by refusing to participate in a virtual hearing. Hence, in late 2020, we went to the governor's office and the governor issued an emergency order that allowed the MIA to require participation in a virtual hearing unless the party lacked the ability to participate effectively. The MIA has invested in virtual hearing tools and infrastructure to make virtual hearings easy for all participants. Consumers and licensees generally prefer virtual hearings. Consumers like the option of participating from the comfort and safety of their homes or places of business without the need to travel sometimes very long distances to the MIA's offices where they must then pay to park. In addition to convenience, the virtual experience eliminates mobility and transportation issues and accommodates social distancing and other health considerations. Translation services are easier to arrange, and the public has better access to virtual hearings, which are, like in-person hearings, posted on the MIA's website with a link that allows public access to the virtual hearing. For those individuals who lack the equipment or skill to participate virtually, the MIA has set up an accessible virtual hearing space within its own offices that can be used by a participant with assistance from an MIA staff member. In calendar year 2021, the MIA held 61 virtual hearings. The governor's order allowing the MIA to compel a virtual hearing expired on August 15th, 2021, and thereafter the MIA conducted 3 in-person hearings and 1 hybrid hearing, all in 2021. Our 18-month experience confirms the utility, the fairness, and frankly, consumer preference for virtual hearings. In our view, there is no reason to treat contested cases before the MIA differently than other administrative agencies by requiring MIA hearings to be held in person. The bill allows the MIA to conduct virtual hearings, subject to the important caveat that no party can be forced to participate virtually if they don't have the ability to exercise their hearing rights in a virtual setting. So I thank you for your time. I'm happy to answer any questions you may have, and we urge a favorable report on this bill.
Thank you, Commissioner Bryan. Senator Augustine.
Thank you, Vice Chair Feldman, and it's good to see you, Commissioner Bryan. I understand the spirit of what you're doing here. I have some concerns about this entire thing where we are making all these things virtual, but that they actually can close some doors for people who don't have access to broadband, or the broadband may go down, and they also just don't necessarily have full information. And so I would just want to share with you that that's a lens that I will be digging deeper into what this would do. And I do really have that concern for a significant portion of Marylanders.
Okay, I don't know if that was a question as much as a comment from Senator Augustine. Chair Kelly.
Yeah, normally I would have had the same concern, but Commissioner, did you say that as a part of this bill, you're agreeing to a provision that would have on-site infrastructure so that a person who lacks broadband and so on, and who needs to do it with help from your staff, could do so at your location?
So that is not in the bill language, but I would be happy to accept that amendment because that is our intent and that is what we have done. We've made a fully accessible on the ground floor place for people who see the benefit of the virtual hearing, but don't have the ability to participate at their own place, can come to us. And then we have a staff member who helps them through that process. We've never had anybody take advantage of it because consumers by and large prefer to be virtual in their own homes, but absolutely would be happy to include that as a requirement.
Well, if it could be included as an amendment, I think it would resolve what Senator Augustine is concerned about. And there are a lot of people who will have cases before your commission who in fact do like, especially right in Baltimore City, but also in northern Baltimore County, where the West Country, where people have access, but they don't always have broadband. Okay, so you want to take first cut at the amendment you'd like to see us include?
We'll be happy to do that and submit.
Thank you.
Okay. Any additional questions for Commissioner Bryan? Okay, seeing none, that concludes the bill hearing on Senate Bill 185. Next bill is Senate Bill 188, and Commissioner Bryan.
Thank you very much. Senate Bill 188 is a departmental bill that is similar to the bill that we just heard with respect to the title insurers. Senate Bill 188 would remove the outdated requirement that the annual review of a managing general agent operation that an insurance company is required to be performed on site and at the MGA's principal place of business. As I noted in connection with annual reviews of title insurance producers, during the pandemic, insurers demonstrated their ability to perform mandated reviews of agency operations remotely. Performance reviews require access to systems and information, and that access is always provided electronically, and it is not necessary for the person conducting the review to be in a particular geographic location in order to secure that access. The on-site review requirement is a vestige of a paper age that is no longer necessary, and it only adds cost to the conduct of annual reviews. So it is the goal of the Insurance Administration to remove the on-site requirement. We thank you for your time. I'm happy to answer any questions, and we urge a favorable passage of this bill.
Any questions for Commissioner Bryan on Senate Bill 188? Okay, seeing none, that concludes the bill hearing on Senate Bill 188, which brings us to our final bill of the afternoon, Senate Bill 207. Commissioner Bryan. Oh, Commissioner, you're muted, so unmute yourself and start over.
I apologize. I have to do that at least once a day, it seems. So thank you again. Senate Bill 207 is a departmental bill that establishes standards for data security and for the investigation and reporting of cybersecurity events by certain licensees of the Insurance Administration, including insurance carriers. The bill is based on and incorporates the key provisions of the Insurance Data Security Model Law that was adopted by the National Association of Insurance Commissioners in 2017, and which has now been passed with significant uniformity in 18 states. Breaking it down, the bill has two major areas of focus. The first is to require covered licensees to implement and maintain comprehensive information security programs that meet specified comprehensive standards. These standards include regular assessments and testing of security risks, system strengths, resources, and protocols, as well as oversight of vendors and third parties with whom data is shared. The security program must also include a written incident response plan that is designed to promptly respond to and recover from a cybersecurity event. The bill also addresses corporate governance and vests responsibility for cybersecurity with the board of directors and executive management of a company. Covered licensees are required to certify their compliance with these requirements annually. Insurance is a $1.28 trillion industry in the US and a $41 billion industry in Maryland, with approximately 1,600 licensed insurers conducting business in the state. While the insurance article does address data privacy, there are no specific provisions that govern data security. This gap is a gap that must be filled as cybersecurity threats continue to increase and insurance carriers are specific and constant targets of cyber criminals and hackers. The second major area of focus is the investigation of cybersecurity events and the reporting of those events to the commissioner. Currently, the commissioner receives what is essentially a copy of information that the insurer sends to the Attorney General under Section 143504 of the Commercial Law article. The notice requirement is narrow, provides no detail, and comes 45 days after the investigation by the business is concluded. That means that when the MIA finally gets notice, it starts from step one in investigating the circumstances of the breach and the evaluation of consumer harm. This bill assures that the commissioner has prompt notice within 3 business days of the occurrence of a cybersecurity event, requires the licensee to provide as much initial information about the breach as they can, and to continue to update and supplement that information as their investigation continues. It is important to note that while it is based on NAIC, the NAIC model, Senate Bill 207 takes an incremental approach to addressing data security in the Maryland insurance market. While the model imposed requirements on essentially all licensees, including producers, Senate Bill 207 is limited to risk-bearing entities and the health claim administrators for those entities. In addition, while most large national and regional insurers have programs in place that meet and frankly exceed the standards within Senate Bill 207, This legislation does consider the needs of smaller regional insurers and that it phases in requirements for compliance with the Information Security Program and insight of third-party service provider obligations. Since the bill dropped, the MIA has met with industry and other stakeholders to discuss potential friendly amendments, and we will continue to work through those suggestions and report back. I thank you for your time, and I, with the assistance of Mr. Dorsey and Associate Commissioners Cooney and Barron, are happy to answer any of your questions.
Okay, any questions for either Commissioner Bryan or her entire team who's here to answer questions? Okay, seeing none, we've got several witnesses have signed up favorable with amendment. We're going to start with Jennifer Breman. Jennifer, you can lead off favorable with amendment.
Great, thank you. Good afternoon, Vice Chair Feldman and members of the committee. I'm Jennifer Breman with the Maryland Managed Care Organization Association. We represent the interests of the 9 MCOs that serve the 1.5 million Marylanders enrolled in the Medicaid Health Choice Program. I come before you today in support with amendments of Senate Bill 207. The implications and the impact of the proposed provisions of Senate Bill 207 are extremely significant, and we will work in collaboration with MIA and other stakeholders to develop language that reflects the commitment of the MCOs to protect the privacy of the health and the personal information of our members. Like my colleagues who will testify after me, we look forward to the continued dialogue surrounding the bill's language and the industry amendments that have been presented to the committee and to the MIA. We surely appreciate Commissioner Barrain's commitment to work through these amendments, and Maryland's MCOs commit to being a partner in the stakeholder discussions. In addition, we've offered amendment language to the MIA in order to correctly cross-reference the managed care organizations for inclusion in the bill's scope, if that is the intent of the department and the will of this body. Thank you for your time and attention.
Okay, thank you, Ms. Breman. And you've submitted suggested amendment language to the committee?
Yes, the industry has submitted that to the department. We discussed it yesterday in a stakeholder meeting, and those are the amendments that we will continue to discuss. And
it was separate than the department, though. Have you sent that to the finance committee? Have you sent that language?
Yes.
Okay.
Yes.
Excellent. Okay.
Thank you.
Any questions for Ms. Breman? Okay, seeing none. Next up is Neil Karkanis, also signed up favorable with the amendment.
Good afternoon, Madam Chair, Vice Chair Feldman, and members of the Senate Finance Committee. My name is Neil Karkanis, here on behalf of the League of Life and Health Insurers, America's Health Insurance Plans, and the American Council of Life Insurers. Thanks again for your time today on Senate Bill 207. As you've heard from the Commissioner, several stakeholders met with the Maryland Insurance Administration this week and discussed this bill, and we're currently working with the MIA on palatable amendments. So I just want to express my gratitude and appreciation to the Commissioner and her team for their willingness to meet with us and try to work through the bill. And just like Ms. Breman said, we hope to achieve a mutually agreed upon solution soon. We have submitted those amendments to the department, and I believe some of those amendments have been sent to the committee. I'll double check on that. But thank you for your time.
Okay, thank you. Any questions for Mr. Karkanis? Seeing none. Next up, we've got Nancy Egan.
Good afternoon, committee. My name is Nancy Egan from the American Property Casualty Insurance Association. We represent 1,200 insurers across the United States and the world, and we represent 60% of the property and casualty market. I will just reiterate what everyone else has said. Me too. We really appreciate the commissioner meeting with us yesterday to begin a framework to address the different concerns that all of the industry has shared. And we appreciate the adoption of the NAIC model law, which gives us a framework across the United States for insurance companies specific in case there is a data breach. So we appreciate the commissioner and we look forward to our working together. Thank you.
Any questions for Ms. Egan? Seeing none, the final witness for this bill and for the afternoon is Bob Etten.
Thank you very much, Mr. Chairman, members of the committee. I see Senator Hayes smiling. One of the, on behalf of the American Property Casualty Insurers Association, and just would echo what all the other witnesses said. It's just really terrific that we can have a dialogue about these issues with the commissioner and her staff, and hopefully, I'm confident that we'll reach an accommodation. Thank you.
Okay, any questions for Mr. Etten? Okay, seeing none, that concludes the bill hearing on our final bill, which was Senate Bill 207. And that concludes the bill hearings for this afternoon. Madam Chair, do you have any closing comments before we adjourn?
No, you ran a nice, efficient hearing, and we appreciate everybody's contributions, and we're looking forward to receiving in short order all of the amendments that people are working hard to agree upon so we can move these bills.
Okay, well then on that note, we declare this hearing day officially adjourned.
Thank you.